To perform the anterior rotation of the left innominate, which is the more common innominate that needs to go anteriorly because it's sometimes held in a posterior direction, get your patient to lie prone on the table with their hip joint over the crease of the table so that you can then extend the hip using the bed. Lying on the table, hip joint over the crease of the bed. This way I'm going to be able to extend his hip and leave it in extension without having to work too hard. His right foot is on the floor and his right hip is flexed, which is posteriorly rotating his right innominate, adding stability to the sacrum. Your hand position is, the thrust is going to be on the PSIS. Your opposite hand can be used to perform a muscle energy technique. So to take the left innominate into anterior rotation, I'm going to extend his left hip by lifting the bed while monitoring his lumbar spine, which we do not want to extend. As soon as there. Good. Okay. Are you comfortable, Johnson?
Yes.
Super. I'm going to take your left innominate into anterior rotation. There's our two. Are you good with that?
Yes.
Great. I'm going to teach you a muscle energy technique to help me pull that innominate into anterior rotation by contracting a muscle called your rectus femoris that attaches to the front of the pelvis at the AIIS. What I'd like you to do is when I say push your knee into the bed, I would like you to push your knee into the bed, which is hip flexion, and relax. Excellent. Good. So I'm going to take up the anterior rotation with my two hands. Push your knee into the bed for 5, 4, 3, 2, 1. Relax. Take up the barrier. Are you good? Are you good?
Yep.
And a little thrust. You could just mobilize in this position as well. And you could use more muscle energy technique using your hand underneath the knee. Lots of options to cause anterior rotation of the innominate on the left.